final talk of this course will be, we need to know this is a very important topic. Dr. Shishir will be speaking. You need to have a medical indemnity. In your private practice, you may have failure and you may have medical legal issues. And this is very important for all ophthalmologists to learn how to protect yourselves. So over to you, Shishir.
Yeah, good morning, everybody, audience and the panel. So I'll be talking on medical indemnity. So to begin with, so no financial interest for this presentation. Are we burdened? So that is the main question. Are we, as ophthalmologists, burdened to give out, free service as well as get new technology? So yes, we are burdened. So there's a high cost of technology in ophthalmology due to the increasing competitive environment and social demand. You sit with some old instruments, somebody beside you will come and sit with more expensive instruments. And we also are under pressure to progressively lower our costs to the consumer. And to keep costs down, there is always a tendency to do more and more surgeries and provide and give more and more free surgeries. So where we are, so according to the Consumer Protection Act in 1986, it had excluded free surgery service from the purview of the Consumer Protection Act. But now, according to the new rules, even though you are providing free surgeries, you are likely to be sued, or if anything goes wrong due to your negligence, you're likely to be sued, even if you're providing free service. So the lessons learned is that in India, there is a prevalent tradition of providing free service, and that has resulted in lowering of guard by eye surgeons. And also there is this mass surgery assembly called free eye camps, which sees that millions of people are being benefited from it. So due to, lowering of guard and doing these free surgeries and more number of cataract surgeries, now even the courts are putting an exorbitant penalty which is imposed by the courts, and this has also destroyed the career of many ophthalmologists. So the main thing is, I am a doctor, not a god, and that's what you have to keep telling yourself as well as to the patient. And so to safeguard yourself, you need three things: primary, secondary, and tertiary prevention. The primary prevention is better, cheaper, and more predictable than cure. So what is the primary prevention? Attention. So when a patient comes to your OPD, attend to them, attend to their complaints, train the reception staff to be nice and speak nicely. If you are having any doubt regarding any disease or diagnosis, get an additional opinion. Sometimes the patient may come saying that the other doctor who has sent the patient has spoiled his eye. Don't ever, tell anything against. Always appreciate your colleagues. And when you're admitting the patient or admitting them for any surgery, get their identification done. Behavior, you have to behave nicely when they present to you. You cannot be rude, or you cannot shout at them even though they seem a little bit frustrating. And always, after providing any service, doing any scans or even buying from the pharmacy, always keep the bills and provide them with the bills. So coming to C, communication is extremely important, and also you need to communicate with them properly, bring your point forward also, and be kind and tell them about what exactly the problem is. Take a consent before doing anything. Taking a photograph is also, you require a consent. When they come to OPD, take a consent that you will be doing some minimal procedures on them. Show compassion, do a proper counseling before surgery, explain the pros and cons, the complications which can happen, at least minimally. And also, CCTV is very important in your hospital. Documentation is something which is going to save you when any medical legal case arises against you. You need to document each and every findings extremely properly, and should show your expertise, also the efficiency and ethics. Ethics is extremely important when you treat a patient. For example, a patient comes with you for LASIK, and you're doing LASIK, and even though the corneal thickness is less than 450 or 400 microns, so be ethical. No need to just because the patient is more demanding, no need to go and over the board and treat them as such. Show empathy, and also you need to, whatever equipment you buy, you need to insure the equipment also. So good faith. So nothing is said to be done or believed in good faith, which is done or believed without due care and attention. So even though you're doing in good faith, do it with due care and attention. So insurance, you need to get an insurance for yourself, the hospital, your staff, the instruments, and also ID proof for the patient, like I mentioned before. So next is the secondary prevention. So secondary prevention is damage control. So once an issue arises, like a medical legal or something arises, you need to have damage control. You need to take advice from medical legal experts. Your associations like the AIOS body or your IMA, they can help you around with it. Then you need to negotiate with the patient party, their lawyers, and then you need to reach a compromise. So that is your secondary prevention. The tertiary prevention is your indemnity. So what is indemnity? So there are two types of insurance, general and life. So indemnity comes under your general insurance. So indemnity insurance are two types again, the professional which you take for yourself as an ophthalmologist, and then there is one for the hospital. So before that you need to understand risk. Risk is attached to all activities of life. It is an event which is harmful to someone, but rare, but does happen in reality. So do not practice without an indemnity insurance. That is a huge risk. So what is medical indemnity insurance? It's a contract under which the insurance company agrees in exchange for the payment of premiums to indemnify or protect the insured doctor because of his claimed professional negligence. So indemnity will compensate for harm or loss which you incur. So it is to protect the professional interest of the insured doctor, to arrange, conduct and pay for defense, and to indemnify the doctor. So it is a contract between you and the insurance company. You need to keep a copy of the policy, read the offer document carefully, and the insured pays premium in proportion to the amount of insurance as per the tariff. So sometimes if you, the insurance company will ask you for co-payment. For example, if you are in a court case and then the court has asked you to pay premium, asked you to pay 40 lakhs, the insurance company will say, I'll pay 30 lakhs for you, you pay the rest of the 10 lakhs. So that is co-payment. So don't agree for that. Read the offer document carefully before you go ahead and ask for the indemnity. So how much amount you need to insure yourself in an ophthalmic practice? So the minimum what they say is 50 lakhs premium. You can take 25 lakhs premium from two different insurance companies, but they say you need to go up to at least 50 lakhs to 1 crore, and if you're owning an hospital, you need an insurance coverage of at least 2 crore. You need a separate hospital and staff insurance of 1 to 2 crores, but the premium per year which you pay to the insurance company, it won't go beyond 40,000 per year, inclusive of the GST. So, and it must be uninterrupted. You can also get cheaper policies if you apply through probably through the IMA or the AIOS official bodies. They are also providing this indemnity insurance. So in any hint or suspicion, or if you receive a complaint letter from the patient or NGOs or a lawyer from the court, you need to inform your insurer and get a signed and stamped acknowledgement from them that you have been sued or for negligence, and then you need to inform them, otherwise later they'll say that you didn't inform and things like that. So I'll just go to the new one. Yeah. So there is a new insurance concept which say that some private insurers, they give a complete risk management. They'll give you insurance for your doctors in your hospital, for the hospital, then Mediclaim plus vehicle plus resident plus etc. And they also have a 24-hour helpline. So retroactive date is the date when the insurance commences and continues uninterrupted should be clearly mentioned in the policy, and the policy period is 1 year. So this I already mentioned that the ophthalmologist needs to have at least 50 to, I'll just finish in a couple of slides, 50 to 1 crore insurance, and if you're having a hospital, you need to have a 2 crore insurance, which will be inclusive of your GST. So sometimes they also provide in ratios, that is 1:1 or 1:2. Sometimes the insurance company will say, sir, we'll provide you for insurance for 2 cases. So if they're providing you 1 crore insurance, it means 50 lakhs you can fight 1 case, 50 lakhs if you have been sued for another case. So never accept that. Always take a 1:1 coverage, although the premiums may be lesser, but always go for a 1:1 coverage. So to sum up, have an indemnity 50 lakhs to 1 crore. It should be an uninterrupted cover till you stop practice. Do not publicize or mention that you have an insurance cover. Remain within your field. Don't provide opinions beyond that. And inform the insurer when you anticipate trouble and take their stamped acknowledgement. So these are some of the exclusions: intoxicated doctor, criminal cases, defamation, third party, etc. And also natural disasters, radiation use. These are few of the exclusions. So there are a lot of cases which have come and doctors have been sued and the courts have asked for a higher compensation, especially cases with ROP, etc. And you need to learn from those cases. These are easily available online on Indian Qanun. Thank you for your attention.
So thank you, Dr. Nikhil. Dr. Anurag, Dr. Atul, Dr. Shweta, and Dr. Shishir for this wonderful course. I think we would like to repeat this course in the near future conferences. And anybody wishes to ask any questions or any doubts regarding this, regarding the topics which we have just covered, because it has covered A to Z of transition from private practice to institutional. I think it's very, very important for the youngsters who wants to start their practice. So once I think there is no more doubts, we'll call the end of the day. And thank you for patient hearing and staying till the end.